At Medicare.gov, it's easy to find and compare plans in your area, see your options, and join a plan that covers what you need at a price you can afford. See your estimated costs based on the drugs you take and pharmacies you choose to help you compare plans. And your online Medicare account makes it faster to save and update your drug list and compare plans at any time. Let's get started. First, visit medicare.gov/plan-compare. Select Login or Create Account for an easier, more personalized experience. Or select Continue without logging in to find plans as a guest. Not sure which Medicare health and drug coverage is right for you? Select Learn More about options. We'll log in. If you log in or create an account, you can quickly add drugs and save your drug list and favorite pharmacies to easily compare plans later. Enter your username and password. If you have Medicare but don't yet have an account, select Create an Account now. After you log into your online Medicare account, you'll see your name and current plan. If you switch plans during open enrollment, October 15th through December 7th, we'll show you the new plan you requested to join if you submitted an application. If you didn't make a change, you'll see your current plan, which you'll keep for next year if it's available. If you get extra help paying drug costs, you'll also see that amount. Start by choosing the type of plan you're interested in. You can choose a Medicare Advantage plan, a standalone drug plan, or a standalone drug plan plus a Medicare supplement insurance policy called Medigap. If you're not sure where to start, you can select I want to learn more about Medicare options before I see plans. Let's choose Medicare Advantage here. Since we're logged in, our information is already filled out for us. Make sure the information is correct, then select Next. If you're not logged in, enter your zip code and select Continue. Be sure to scroll down to select your county. We'll ask you if you get help with your costs from programs like Medicaid or Extra Help. Once you answer this question, scroll down and select Next. We'll then ask you if you want to see drug costs when comparing plans. Checking Yes to seeing drug costs can help you get a better idea of what your costs would be in each plan based on your current prescriptions. Then select Next. Now, let's update a saved drug list. If you're logged in and you saved a drug list before, you'll see your saved drug list. If you don't see all the drugs you take regularly, select Add Recently Filled Drugs to see all the prescriptions you filled in the last 12 months. Check the boxes for each drug you take regularly. If you take all the drugs shown, just check the top box to select all the drugs. Then select Next. If you check a box by accident, it's fine. Just click it again to uncheck it. We'll add one of the drugs on the list, Nexium. You'll return to your saved drug list. Confirm that the drugs listed are the ones you're currently taking regularly. Don't list drugs you take temporarily, like an antibiotic. This will help you better estimate your regular drug costs and help you find the lowest cost plan. Don't see a drug you take on a regular basis on your list? Select Add Another Drug to add it manually. Enter the drug name and select Add Drug. We'll add Lantus, a type of insulin. If available, it'll ask you if you want to switch to a generic drug or keep the brand name drug you entered. Generally, generic drugs lower your costs, but make sure you add the name of the drug your doctor prescribed. You'll then add the dosage, the quantity you take, and how often you refill the prescription, like 30 pills every month, which is 1 pill per day. For some drugs, you'll add how it comes packaged. Check your prescription package for this information, or contact your doctor or pharmacy. The information is added for Lantus, so we'll select Add to my drug list. After you add a drug, you'll return to your drug list and see that it's been added. If the list has drugs you no longer take, or there's a drug listed that you don't recognize, you can remove the drug. If the dosage, quantity, or frequency of a drug you still take has changed, you can edit it. We'll edit Nexium and change the dosage to 20 milligrams and quantity to 15 pills each month, which is about 1 pill every other day. Then select Update this drug. This will update the drug on your saved list. Once the list shows all the drugs you take with the correct dosage, quantity, and frequency, select Done Adding Drugs. Let's look for pharmacies. If you're logged in and have already saved a pharmacy list, you'll see that here. Check to make sure the pharmacies listed are ones you would use to fill your prescriptions. If you no longer use a pharmacy, select Remove Pharmacy to take it off your list. If you don't see a pharmacy you would use, select Add Another Pharmacy. You can choose up to 5 pharmacies where you would fill your prescriptions. Drug costs can vary in each plan based on the pharmacy you use. Picking different pharmacies lets you see how plans work with those pharmacies and which would have the lowest costs. You'll be able to see the costs of your drugs at each pharmacy in Plan Details later in your search. Pick pharmacies you use now, or choose other pharmacies in your area to see if one may offer lower costs. To find pharmacies in your area, you can enter a specific pharmacy name, search by zip code, or search by your address to find the closest pharmacy if there are a lot in your area. Then, select Find Pharmacies. You can use the distance filter to show more or fewer pharmacies and see the ones that are closest to you. You can also use the map on the right to see their locations. Mail order pharmacy is listed first. Every plan with drug coverage offers mail order. It's usually a lower cost option, but not always, so it's a good idea to look at some other pharmacies too. If you select mail order, you can pick up to 4 other pharmacies. Choose the pharmacies you want by checking the Add Pharmacy box. As you choose pharmacies, they also appear in the blue bar at the bottom of the screen. To remove a pharmacy you don't want, select the X for the pharmacy in the blue bar, or uncheck the box next to the pharmacy name on the list. When you're done picking pharmacies, select Done on the far right side of the blue bar. We'll pick Mail Order and 4 pharmacies. Next, let's learn how to filter plans. You'll now get the results from your plan search. During Medicare open enrollment, the first plan listed is usually your current plan for next year, unless you join a different plan. It's a good idea to look at your plan's benefits for next year to see what's changed and if your current plan will still meet your needs. When you're done, you can minimize that window by selecting Your Next Plan. If you want to see it again, just select Your Next Plan again. Use the filters above to see plans that only include benefits you want. For example, if you only want to see plans that include both vision and dental, select those choices from the Plan Benefits filter. If you only want to see plans with drug coverage, select that in the Drug Coverage filter. The other filters allow you to see only certain types of plans, plans with a certain Medicare star rating, or plans offered by a certain insurance carrier. We'll pick Vision, Dental, and Includes Drug Coverage. Plans are sorted automatically by the lowest drug plus premium cost, but you can sort in other ways too. Let's take a look at one plan's information. As you view a plan, you'll see many important things to consider. You'll see its overall star rating between 1 and 5 stars. You'll also see some of the different costs and benefits it offers, and whether it includes drug coverage. Looking a little closer at the costs, you'll see the plan's monthly premium. Since we're looking at Medicare Advantage and other health plans, the information reminds you that you need to keep your Part B coverage to join and stay in the plan once your plan coverage starts. Remember, you'll have to pay your Part B monthly premium in addition to the plan's premium. You'll see your estimated yearly drug plus premium cost since this plan includes drug coverage. This amount is an estimate of the costs to fill the drugs you entered at the pharmacies you chose, plus your monthly premiums. But it doesn't include any estimated health costs like copays or deductibles. If you're looking for a plan for next year during Medicare's open enrollment, this cost will provide an estimate of the amount you may pay for your premiums and drugs for the entire year. But if you're looking at plans in the middle of the year, this will include costs for the rest of the months left in the year. For example, if you're looking at plans in May, it will include the costs for June through December. Remember, this estimate doesn't include other costs for health services. You'll also see other costs, like the maximum amounts and copays you pay for health services. To learn more about what each of these items are, select the underlined text to open a window with more information. To get more details about a plan, its costs, and what's covered, select Plan Details. The blue bar at the top shows you a couple of important costs like the monthly premium, health deductible, your primary doctor copay, and your estimated total drug costs. Scroll down or select Overview to see more important cost information. Continue scrolling or select Benefits and Costs to see what your costs and coverage would be for things like doctor's visits, tests, hospital services, and more. Next, you'll find drug coverage. This shows you if the pharmacies you chose are out-of-network, standard in-network, or preferred in-network. Generally, costs are lower if you use an in-network pharmacy. If a pharmacy you chose is out-of-network, select Find an in-network pharmacy to switch to an in-network pharmacy in your area. You can even filter these pharmacies if you only want to find preferred in-network pharmacies, which usually offer the lowest cost for drugs. Once you're done adding pharmacies, select Done. As you scroll down, you'll also see detailed information about the costs for each drug you take at each pharmacy you chose. If the plan doesn't cover a drug you take, it will display the full retail cost across all the columns. If the plan doesn't cover a drug you take, you can look at other plans or consider asking your doctor whether you can take a generic drug instead of the brand name drug to help lower your costs. Then, you'll see your total yearly drug plus premium cost when you fill your prescriptions at each of your pharmacies, and you'll see when you'll meet your yearly deductible. Generally, you'll want to look at your estimated monthly drug costs to see your costs broken down for each month of the year. As you scroll down, you'll also see things like any extra benefits the plan offers. If there are any optional packages you can buy in addition to the plan, and the plan's star ratings. When you're done looking at plan details, scroll to the top of the page and select Back to Search Results. You'll come back to your search results, and at the top you'll see your current plan again. You can minimize it again by selecting Your Next Plan. Let's learn how to compare up to 3 plans. You can select up to 3 plans to compare at one time. To select plans to compare, check the Add to Compare box. You'll then see it in the blue bar at the bottom of your screen. If you're currently in a plan, it will be automatically included in the blue bar. You can keep it to compare, or you can remove it and compare a different plan. Once you've added all the plans you want to compare, select Compare on the right end of the blue bar. We'll pick 3 plans to compare. Now you see all of the plans you chose side by side, along with the total monthly plan premium. First, you'll see an overview of each plan, like its star rating and basic cost information, like premium and deductibles. Then, scroll down to see more information about each plan, like benefits and costs, whether the plan covers extra benefits, and a quick view of your estimated drug plus premium cost for each pharmacy you chose. When you find a plan you're interested in, scroll to the top or bottom of the page and select Plan Details for more information, or return to your search results by selecting Back to Plan Results in the left of the screen. When you find the plan you want to join, select Enroll. A pop-up window will start your application to join the plan. After you complete your application, you'll get a confirmation number. You can also contact the plan directly to join. To get the plan's contact information, select Plan Details. The plan's contact information is at the end of the Overview section of the Plan Details page. Once you submit your application to join a plan, you'll hear from the plan after they verify your information and confirm your enrollment. If you have a Medicare account, it takes at least 10 days for your new plan to show in your account. If you have any questions about your new plan, you should contact the plan directly. When you're done using your account, be sure to log out and close the browser window to help keep your information secure. Need more help picking a plan? Call 1-800-MEDICARE, 1-800-633-4227. TTY users can call 1-877-486-2048.
This product was produced at U.S. taxpayer expense.